coming to the next chapter, let's listen to a story. A father walked to the orthopedic emergency and said, "Doctor, my child had a fall. His left thigh is swollen and he is not moving his limb." The doctor he met has a stethoscope, lab coat, and is ready to help. Can you name this doctor? Stethoscope, lab coat, ready to help. This is an Indian intern, also called as Great Indian Intern, also called as God's special child. It reminds me of the classical Shah Rukh Khan movie Main Hoon Na. They are always holding your hand, assuring you. He is the most well-read doctor of the hospital, always punctual, most sincere. In recent times, they are always covered in multiple suits, but these are the doctors who feel the pain. They remember why they took this field, and they will walk to you and say, "Please tell me what happened to your child." Father will say, "Doctor, my child had a fall from a swing. मेरा बच्चा झूले से गिर गया. He has not been moving his limb." And this doctor is usually alone in the emergencies because the senior resident, SR, also called as Sote Raho, is usually not present there. And because this intern, the great Indian intern, the God's special child, is alone in the emergencies, there is a movie made on them, Ek Tha Tiger. So who is a tiger? An intern is a tiger. So tiger walks to the father. He talks about future. He has to educate the society. So he walks to the father and says, "Learn to take care of your children." Father is humbled. He says, "Okay, sir, I will be careful." He says, "Please place the child on the examination couch." The child is placed in the examination couch. And then the tiger will say to the sister, "Pulse, BP, temperature." Tiger is in the authority. Sister will say, "Pulse is 100 per minute. BP is 90/60. Temperature is afebrile." Then the tiger will walk. The walk of a tiger for looking at the swollen thigh. And he will say, "Oh my God, this thigh is swollen." Tiger's eyes, it can scan everything. It can do the X-ray, MRI, CT, PET scan. Some well-read tiger can tell you the biopsy finding also looking at a distance. I remember when I was a co-tiger, my co-tiger, we were sitting in the medicine OPD and one of the patients walked inside and he said, "Doctor," even before he could speak anything, my co-tiger placed a hand on my hand and said, "CRF." I said, "What the hell is CRF?" He said, "Chronic renal failure." My co-tiger, he was the university topper. I was roll number 11. He was roll number 10. Imagine the pain. Roll number 10 is university topper. You are roll number 11. Every exam, his paper will be checked before yours. He will give interview before you. He will answer before you. You know how people will look at you? Many people even doubted, am I a student of MBBS? Because this boy will set the bar so high. We will talk about roll number 10 in my later lectures. But then roll number 10, there was something about him. The way he used to play cricket, the way he used to sing songs, and the way he used to deliver answers. And when he spoke to me, chronic renal failure, I was wondering, how the hell does he know it? But roll number 10 is roll number 10. And then that man started speaking. I looked at him. I was just waiting for him to come with the features of CRF. But you know what he said? I want to show my mother. And this is what is tigership. A different era. You are in your own world. And then I'm looking at roll number 10. Where is CRF? So there is no CRF. But then tigership, you can identify from a distance. So our tiger went to the child with a stethoscope. You know, children are scared of lab coats. They are scared of stethoscopes. They are scared of doctors. The moment the child saw the tiger, he started crying. Even before the tiger could reach there, right? The child said no. But you know the tiger, the brilliant tiger, he could see the swollen thigh. He could relate to the history of fall. So he says, walked to the father and said, unfortunately, your child has a fracture. Father said, okay. This involves the longest bone in human body. Father said, okay. The length of this bone is equal to spinal cord. Father is impressed. What a knowledge. And then he names the bone femur. Father is clean bowled. He says, doctor, I swear on my Lord, I will not allow any other doctor to touch my child. You will be the only one to take care of him. The tiger said, I am the only one here. There is nobody else available also. Father said, okay, sir. Now what? He says, let me make the child comfortable. You know, he is a compassionate tiger. He will give fluids to the child, give analgesia to the child, and then splint the child. Splint. The role of a splint, immobilize the body part. The rule of a splint, immobilize a joint above and a joint below. For example, if you have to immobilize the forearm, you need to immobilize the elbow and the wrist. So here, the thigh, so the hip and knee were immobilized. And then the child was sent for the X-ray. And then the tiger called up the SR. Sir, please come. I have a child with a long bone injury with anxious parents. The SR said, have you got the X-ray done? He said, yes. By the time the SR came, the child came back with the X-rays. The moment SR entered the emergency, he requested, please call the mother. Now, the father is looking at the SR. What has he got to do with my wife? Why is he calling my wife? And you know, tiger is looking at the SR. Why are you doing this? But then, the father finally walks and says, doctor, I am the child's father. Can you talk to me? The SR asked the father, did you see the child falling? Were you there when he had a fall? And the father said, no, I was not there. And then the tiger is looking at the father. Chal jhoote, you lied to me. You told me your child had a fall. And then the father said, I'm not very sure. And then the tiger looks at the SR. SR understands what has gone by. SR tells the tiger, in pediatric population, learn to take history from the mother. This time, the tiger is furious and he says, call the mother. The moment mother walks in, the tiger asks the mother, did you see your child falling? The mother said, no, I was not there. Now there is confusion. The history of trauma, which was rock solid, is dwindling. There is a doubt, question mark. And now The mother says, the child had gone to play with the younger sister. We can talk to the younger sister. And then, the younger sister, she walks in with a crying brother and says, I didn't do it. I was not the one to push him. So the history is zero. Doesn't lead us anywhere. The SR says, let me do a clinical examination. But our SR is mature. He doesn't react. He goes to the bedside, opens the splint, rotates the foot of the child. With the foot, the ankle rotates. With the ankle, the leg rotates. With the leg, the knee rotates. With the knee, the thigh rotates. With the thigh, the trochanter rotates. The movement is getting transmitted proximally. There is no abnormal mobility. So SR looks in the eyes of his tiger and says, I don't think so, there's a fracture. But he doesn't utter a word. You know why? Because SR will come to the emergency maybe for a few minutes or few hours, but the tiger will be there around the clock. And if he tries to downgrade the tiger, the society will not take it easy. They will wait for them to make some mistake. And then the SR says to the father, can you wait outside? We need to discuss the imaging. He looks at the X-ray and the X-ray is normal. Our tiger is perplexed. He is confused. Where did he go wrong? And then the father, he is brought in. And the SR walks to him and says, your child is very fortunate. Although he has a swelling, no movement, but his bone is intact. So the SR, the senior person, covers up for the communication that the junior has given up, so that the society doesn't manhandle the junior person. The rule of medical science: stand with your peers, stand with your juniors, support each other, because it's a circle. If you put somebody down, when he would be up, you would be down. So take care that we have to uplift each other, hold on to each other, and build on to a team. Remember, we live in a society. Be compassionate. We all are students of science. And that's why it said, the learning never ends. But then the question is, what is the child suffering from? And then our SR does what a senior should do. Teaches his junior. Tells him, in a pediatric population, if you have ruled out trauma, absent movement of a joint is joint infection called as septic arthritis, and absent movement of the whole limb is a more serious condition, bone infection, called as osteomyelitis. So in all probability, this child is suffering from early infection. So dear friends, when we talk about orthopedics imaging, MRI takes the crown. When we talk about infections, our dear friend Staphylococcus aureus takes the crown. This is the organism which will cause infection. Staph aureus is the answer you will mark for infections of orthopedics. If you know the answer, mark staph. If you don't know the answer, mark staph. If you are awake, mark staph. If you are sleeping, mark staph. If you are alive, mark staph. If you are leaving the world, mark staph. Because ortho is married to staph. But friends, then we have extramarital affairs. Let's have a look at some. If they talk about sickle cell anemia, it should come to your mind they are talking about salmonella, but there is a catch. Staph involves the metaphysis. Infections and tumors, they involve the metaphysis. But in sickle cell anemia, salmonella affects the diaphysis, the middle of a bone. Drug abusers, foot wounds, pseudomonas. Open injuries, staph aureus. Human bites, Eikenella. Animal bite, Pasteurella. Do you know which is the most dangerous bite in the world? It's the human bite. You know which is the most poisonous organism? It's the human beings. And then let's have a look at some important things. Let's talk about the positions of lower limb. Feber, Fadir. If you are doing orthopedics, these are the positions that should be right here. Even if you are deep asleep, somebody shakes you and wakes you. And he says, name what is Feber. You will tell him it means flexion, abduction, external rotation of the lower limb. It's a position in which joint has more capacity, maximum capacity, more content can come in. Opposite to it, flexion, adduction, internal rotation, less capacity. As long as people remember medical science, and ortho is one of them, this page should be in the core of your heart. Feber, synovial proliferation called as synovitis, more content inside. Fluid inside called as septic arthritis, more content inside. Iliotibial band goes from ilia, crosses the hip, crosses the knee, goes to tibia. Iliotibial band, when it's shortened out, called as contracture. A muscle contracts, relaxes. Sudden contraction, spasm. Permanent shortening, contracture. Iliotibial band contracture. Seen in polio, Feber. And the last one, anterior dislocation. The head comes out of the acetabulum, anterior dislocation, Feber. Whereas Fadir, seen in posterior dislocation. Catch. Anterior dislocation is number 4 in the causes of Feber. Whereas posterior dislocation is number 1 in the causes of Fadir, because hip dislocates 90% of times posteriorly. And now I want to tell you something here. You know the septic arthritis here? It just means pus in the joint, fluid in the joint. It's a misnomer. If you do not treat it properly, then it will lead to actual arthritis. And in that situation, you will have damage to the cartilage and Fadir. This table you must remember. And then coming to test for iliotibial band contracture. The examiner will do abduction, will flex the knee, external the hip. So abduction at the hip, flex the knee to 90-degree external, drop the thigh. If the thigh drops towards the opposite knee, it is a negative test. But if the thigh stays up, it's a positive test. This test is called as Obey test. It is for iliotibial band contractures. Coming to the infections. Why metaphysis? Because metaphysis do not have well-developed monocyte macrophage system. Why metaphysis? More blood supply, more organisms. Why metaphysis? Because the blood vessels at metaphysis have a hairpin loop system. They take a turn, and when they take a turn, there is a localized vascular stasis. And when there is a localized vascular stasis, more time for the organism to sit in. And also remember, this area has microtrauma, some blood pooling in, causing blood pool, which is a good culture medium for organisms. So metaphysis, commonest location, 4 causes. Commonest site of infections. For osteomyelitis, lower end femur. For joints, knee joint. But if we talk about adults' involvement, remember, in adults, vertebral body is involved. But the organism still is staph aureus. So even with spine involvement, People might think it's tuberculosis. No, it is still Staph aureus because ortho is staph, staph is ortho. When you are diagnosing or treating an infection, remember, reduced movement of a limb, toxic child, the one who doesn't eat, doesn't drink, high grade fever, high markers, tender metaphysis establishes the diagnosis of osteomyelitis. If you have osteomyelitis, you pick it up in the first day, get an X-ray which will be normal. MRI will start showing you changes. It starts showing you changes in 6 hours. Bone scan, which will show you increased activity, but MRI before bone scan. Treatment is conservative, that is, start IV antibiotics. Give rest to the part. See how it improves. If the fever settles, the diet improves, the sleep improves, continue antibiotics. The usual dictum is 2 weeks of IV, 4 weeks of oral. But give an antibiotic which covers Staph aureus well, because that's the most common organism. But if the child presents late, he will have more than 24 hours, X-rays, loss of soft tissue planes. MRI will have changes on the marrow. Bone scan, increase activity. When you have changes on the X-rays, you can't have conservative management. You need to operate. So, MRI might pick it up early, but once the changes come on the X-ray, it means you need to operate. Whether you operate or you don't operate, the duration of antibiotic is the same, 6 weeks. Remember the dictum. Also in osteomyelitis, bone infection, first 24 hours, you have an option to prevent the surgery. Looking at the joint infection. Now this is a catch here. Reduce movement of a joint with Faber. Look at how much is the movement decreased. If the child is 0 to 5, toxic, absent movement, it means you're dealing with infection. Organism, Staph aureus. Ortho Staph, Staph ortho. Do the diagnosis by X-mass, get X-ray, get MRI, aspirate by ultrasound guided. And if you are suspecting joint infection, every hour is valuable. So you will go for surgery. And antibiotics. The duration, 6 weeks. Whether it's bone or the joint, the duration of antibiotic stays the same, 6 weeks. As compared to it, age group 6 to 12 years, decreased movement of the joint. You are thinking of temporary proliferation of synovium called as transient synovitis. Again, the order of investigation is the same. X-ray, MRI, aspiration, but the treatment is rest to the body part. So, a very valuable clinical difference. Decreased movement, temporary proliferation, absent movement, septic arthritis. But to differentiate, remember, we always have to look at the age also and the movement also, but do not hesitate to get an X-ray, get an MRI or the aspiration by ultrasounds. Because when a joint is infected, if the cartilage gets damaged, there is no looking back. To give you such an example, if there is a septic arthritis of a child less than 1 year of age, it can just destroy. Look at the femoral epiphysis. Look at this, gone, destroyed. It can just destroy the femoral capital epiphysis. And in such a scenario, in the early stage, child will have absent movement. But when a body part is gone, there will be increased movement called as hypermobility and instability. This is called as Tom Smith arthritis. NB people love it. Very commonly asked. Infections, they have one feature. When they infect the bone, you can get away with non-operative management if you're quick, within 24 hours. Infection of joints, they destroy the cartilage, require surgical intervention. Non-operative management does not exist in joint infections. Just like in cricket, benefit of doubt goes to the batsman. In case of joint infections, even if you operate, it doesn't turn out to be infection, you are forgiven. But if you do not operate an infected joint, the joint goes for a toss, game over. Coming to other varieties of infections going forward, Brody's abscess, as described, is classically a subacute osteomyelitis, can be chronic osteomyelitis too. Involves the upper end of tibia, will have sclerotic margins. These are sclerotic margins. What is sclerotic margin? The infection is trying to spread. The body's immunity is trying to stop it. Thus, Brody's is not seen in immunodeficient host like HIV, AIDS. Brody's is seen in immunocompetent patients. Remember that.